Hello and welcome to LabLife for the IBMS pod. My name's Dr. Martin Khechara and I'm from the University of Wolverhampton. And again, I'm your guest presenter for this part of the IBMS podcast. Today, I've got a very special guest who has literally the future of humankind in their portfolio. Why don't you tell us who you are and what you do?
So thank you for inviting me to take part in this exciting blog post. My name is Sheryl Homa and I'm a biochemist. I'm also a state registered clinical scientist. And currently I have been working in a male fertility clinic, which I set up in 2007. And this fertility clinic is licensed by the Human Fertilization and Embryology Authority. And we are the only licensed clinic in the UK that focuses directly on male infertility. I also have the pleasure of having an honorary position at University of Kent so that I can also be associated with academic research as well. And this is how I spend my time.
Fabulous. So it's clear, you know, from the research that I've done that you've had a really successful career so far. So how did you get to where you've got to today?
So that's a really interesting question, Martin, because I never would have thought all those many years ago when I graduated with my degrees in biochemistry that I would end up in this particular field. But I did start my career as an academic research scientist. I'd worked for many years actually in the United States, where I was working on oocyte maturation. And during that time, I was collaborating with a reproductive physiologist, also working on oocytes. I was looking at signaling mechanisms to trigger resumption of oocyte maturation. And my colleague got involved with a gynecologist who wanted to set up an IVF clinic. And this was very early days. This was back in the mid-1980s when IVF was really just beginning to take off really in the world. And he brought me along to see what IVF was all about. And of course, that was the sort of clinical application really of some of the early work that we were doing, looking at regulation of egg development. And it was terribly exciting for me. And I was just thrilled at the idea that the work that we were doing might have some implication to fertility. So when I returned to the UK, one of the things I thought I would do is get some experience working in the field of IVF. And I became fascinated with clinical embryology. And I was very fortunate to get a post at Barts Hospital, which involved running the IVF unit, the laboratory at the Barts IVF unit there. And at the same time, I had an academic post as well, which allowed me to pursue some of my academic work. So it was really ideal. And from there, I was working IVF for quite some time when it dawned on me that really there was a huge lack of investigation and acknowledgement of the role of the man, the sperm, if you like, in creating healthy ongoing embryos. And so over time, I decided that I wanted to set up my own clinic where we would actually be looking at the male fertility side of things. So here I am today. I took the leap in 2007. It was quite scary because I'd only ever worked for a hospital environment, and to set up my own clinic was quite scary, I must say. But here we are in 2021 and we're going strong, and this is where I am right now.
Now, of course, when we're talking about male fertility, especially in terms of biomedical science, we're talking about andrology, I guess. So what is that, and where does it fit in the disciplines of biomedical science?
So andrology has always been marginalized, I think, in every aspect, not just for male infertility, but in terms of from a professional point of view, where we see it. unlike gynecology, which is the study of the female reproductive tract, andrology is the study of the male reproductive tract. And yet, you know, we've all heard of gynecologists, but very few people recognize the role of andrologists. And unfortunately, it is very marginalized, and it needs to have its own platform so that it is put equally important, if you like, with gynecology.
Yes, because I know that sometimes you see andrology in the corner of the microbiology lab, sometimes in cytology. You know, it seems to be something that is a bit of a forgotten discipline almost within biomedical science, that's just put to one side.
Absolutely. And I think part of the problem is that the investigations for male infertility are quite limited, and it's always seemed to be the sort of second-rate aspect of a particular discipline. And actually it is its own discipline, and it has every right to be considered and treated as its own discipline and have its own department.
Absolutely. I mean, what are some of the most common causes of male infertility that you might see?
So again, male infertility, just like female infertility, is usually a clinical problem. It is a pathology, and so we have to look at it in that way. And if we look at the conditions that are associated with male infertility, the leading known cause of male infertility is varicocele. So 40% of men with primary infertility have varicocele, and up to 80% of men with secondary infertility have varicocele. The problem is that a lot of fertile men have varicoceles as well. About 15% of fertile men have varicoceles. And it doesn't affect everybody, but it is nonetheless the leading known cause.
You mentioned the word varicocele there as a condition that is very common in men causing infertility. What actually is it?
So varicocele is a clump of varicose veins within the testis itself. And because you have this clump of varicose veins, you have an impairment in blood flow. You have a lot of toxins coming from the kidneys. You have an increase in testicular heat as a result of that, because the blood coming from the body at 37 is heating up the testes, which should be at 33, 34 degrees. And you've also got a restriction in oxygen nutrients coming into the testes. So, I mean,
fertility, it's a fairly controversial subject. You know, it's in the media, and it has been very recently. And the sort of word on the street is that overall fertility is on the decrease. I mean, is that really the case?
So the evidence shows that it is on the decrease. What we don't really know is what is actually impacting male infertility. There are some studies that show it might be environmental. Certainly when we look at where the decreases are, they tend to be in the Western world. So it may have something to do with our diet, the way that we lead our lives, our lifestyle, for example. So all of these factors may contribute, but they're clearly not the only causes of male infertility. And I think it's a little bit of a misconception, if I can use that word, that the only thing that you can do about male infertility is to change your diet and your lifestyle and take a few supplements and you'll be fine. I think we mustn't forget that when we're looking at male infertility, the underlying clinical causes, of which varicocele is only one.
Now, I'm very jealous right now because you featured on a BBC documentary called Stand Up to Fertility with the excellent and slightly hunky Rhod Gilbert. So what was that like?
So Rhod is the most amazing human being. I have great respect for Rhod because he's really done so much to raise awareness of infertility, to talk about this taboo subject. And he's really getting people to talk about it. So he initiated his campaign, the Homa Fertility campaign, back in January 2021. And since that time, he's set up, together with the largest infertility charity, which is the Fertility Network UK, he's set up a support group, which is for men only. So only men can join this group. And it provides them a platform where they can really engage with other men who are experiencing similar problems to themselves, where they can talk without the focus being on the woman, as it always has been, and recognize that they are not the only ones suffering, that there are a lot of people out there experiencing what they are. And in actual fact, the statistics show that approximately 1 in 12 men are having problems with their fertility. So it is quite a common thing, and men need to feel supported, and they can talk about it, and it does help when you do talk.
Now, although, of course, we've got people like Rhod Gilbert bringing problems of male infertility into the media, it seems to be still a bit of a taboo subject. It's sort of talked about in hushed tones in corners and things like that. And there's some obvious social cultural barriers around the conversations that could be had around male infertility. How do you think we can break down some of those barriers?
I think it's very difficult, because I think there are so many different areas where we could make changes. So, for example, I think we need to make changes in our social environments. We need to talk about it more, make it more acceptable. We need to bring it into the classrooms, I think, very importantly, because the classrooms focus too much on how not to have babies and children and using condoms, etc., to prevent getting people pregnant. But what they don't focus on is talking about the issue of trying to make sure that you do everything you can to keep yourself fertile. One of the big issues right now is the use of anabolic steroids, which is a major problem for young adolescents and young men. And they don't realize the impact that has on their fertility. And I think we need to be talking more about this, both in schools and universities, and general, amongst ourselves and in the media. And the media needs to be aware that as much as there are problems for female infertility, that this is also equally a man's problem as well. And it contributes in up to 50% of cases of infertility.
Wow. I mean, if everybody's like me out there right now, they might be thinking exactly the same thing that I am. And what I want to know is you literally help people to make babies, but do you ever get to meet any of the babies you've helped to make?
Yes, I do, fortunately. A lot of the people do keep in touch, and they do send lots of photos. I get emails, regular updates every year. This is our yearly photo. But one in particular, which I think would be quite interesting, because this was a couple from Wolverhampton, strangely enough. And this couple had been trying to conceive for 15 years. And they had multiple IVF, ICSI attempts, where you microinject the sperm directly into the egg without fertilization. So you would think, gosh, this is a serious problem. You're putting the sperm into the egg and the eggs are still not getting fertilized. And they came to see me, and the chap had never really been properly investigated. And of course, one of the main things about fertilization is that the sperm has to activate the egg using an enzyme called PLC-zeta. And I fortunately had some links with a colleague in Oxford, Professor Kevin Coward, who carries out some tests looking at PLC-zeta activity. And we sent him down there, and he looked at his sperm, and he didn't have any PLC-zeta. So obviously that was why the eggs weren't fertilizing. So we managed to send him to a clinic that was doing artificial egg activation. And they came back to see me a year or so later with a healthy little boy. And this was the first time they'd ever had embryos, first time they'd ever got pregnancy. and it resulted in this little boy, which was just delightful, just delightful.
What a fantastic story. You know, really looking at that more sort of advanced test was the key to actually allowing them to conceive. You know, so that sort of leads us on to where the future might be going in your subject area. So where do you see the future of andrology in the next 10 years?
So I think andrology, we really need to increase the diversity of the testing that we offer for male infertility. Currently, if a man goes and sees his GP, he's sent to an andrology lab where he gets a semen analysis, end of story. And it's all the diagnosis is based on the semen analysis. In other words, if there's poor semen analysis, the couple are referred for IVF. There are so many other tests coming out now. There's a lot of evidence coming out in the literature for other things that are important that should be incorporated into an andrology lab for advanced testing. We're looking at things like oxidative stress, DNA fragmentation, even looking at the male semen microbiome, which, you know, as a microbiologist, you should be interested in, because there's more evidence coming to light to show that the seminal microbiome can have a significant impact on male infertility, and also certainly in the female with regard to ongoing pregnancy and miscarriages. So I think all of these things we need to be aware of. We also need to be aware of our role in guiding the doctors appropriately, because diagnostic testing for semen analysis, if it's poor, doesn't mean that the patient should be referred for IVF. That's not a treatment. It's a circumvention. A treatment is to actually go and be seen by urologists to investigate clinical issues like varicocele, like microlithiasis, like in male accessory gland infection and prostatitis, all of these things that can affect fertility. And this is the role of the andrologist, to be able to offer these tests and make the appropriate comments to the GP so that they can refer appropriate.
I'm really hoping that watching or listening to this, we might have some student biomedical scientists or some practicing biomedical scientists that are now really interested in a career, perhaps in andrology. So what sort of advice would you give to those people?
Well, I think, first of all, it's great to be interested. And I think you really have a huge role to play if you're going to be an andrologist. Don't let yourself be put into a corner. You need a voice. We andrologists need a voice more than anybody else to show just how important the work is that we are doing. And never forget the patient behind the test that you're looking at. I think if you want to be an andrologist, there are some courses out there. I do actually teach on the STP andrology course, which is currently being run by Dr. Michael Carroll up in Manchester Metropolitan University. So if you can get yourself onto one of those courses, that's terrific. They are hard to get onto because there aren't many places, but that's a really good starting point, because you can also get state registration as well at the same time. I mean, there's also, if you want to just sort of get your regular state registration as a biomedical scientist, and then get training in andrology in an andrology laboratory, that's also a very, very good way to do it. So I think those are the main ways that you can get into the field, per se. And then there's the clinical aspects as well, which are done in IVF clinics. And again, andrologists need to speak very loudly when they're working in an IVF lab, because it's mainly run by embryologists and the andrology is sort of just on the side. But you really need to be standing up for your men.
Well, thank you for that. Well, that's all we've got time for today, Sheryl. So again, thank you for taking the time to speak to us on LabLife. And I'll see you, hopefully, again soon.
Thank you so much, Martin. It's been my pleasure. Thank you.
Well, folks, that's all the time we've got for LabLife today. If you want to watch the fantastic documentary that Sheryl Homa features in with Rhod Gilbert, you can watch that online on the BBC, and it's on for like the next couple of months. Thanks for watching or listening, everyone. Ta-ra a bit.